High blood pressure, hypertension, is a common condition among older adults and a major risk factor for heart disease and stroke. When blood pressure is higher than 130 over 80 millimeters of mercury, the threshold set by the American Heart Association and other groups, the heart has to work harder to pump blood, putting extra strain on blood vessels. Over time, this strain can damage arteries and lead to heart attacks, strokes, and kidney disease. The good news is that lifestyle changes, especially physical activity, can dramatically improve blood pressure without relying solely on medications. So in this video, we'll reveal 7 best exercises to lower high blood pressure naturally, and also guide you why exercise work, how to get started safely, and how much exercise is enough for you according to your age. Regular exercise isn't just about working out. It's a safe, drug-free way to strengthen your heart, improve circulation, and help your blood vessels become more flexible. Even small increases in physical activity can positively affect blood pressure, and benefits begin before you reach the recommended 150 minutes per week. For older adults, exercise also improves balance, coordination, mood, and brain health. Think of it as an investment in your independence and quality of life. Now comment on your age and location so we can see how far our efforts for a healthy lifestyle, especially for older adults, are reaching. This will also encourage our research team to keep working even harder for you. Why exercise works. When you move your body, your heart pumps more efficiently. Aerobic activities like walking or dancing use large muscle groups rhythmically, prompting blood vessels to dilate and improving the way they respond to changes in pressure. Over time, regular aerobic exercise can reduce systolic blood pressure by 5 to 7 millimeters of mercury or more. Strength training exercises build muscle and improve blood sugar control, while certain isometric exercises, static holds, can lower blood pressure even further. A recent analysis of 270 clinical trials found that isometric exercises, such as wall sits and planks, produce the most significant reductions in both systolic and diastolic blood pressure. Circuit-based resistance training, which involves moving quickly between strength exercises, reduce systolic pressure by about 6 millimeters of mercury and diastolic pressure by nearly 3 millimeters of mercury in older adults. Getting started safely before beginning any exercise program, talk with your healthcare provider, especially if you have heart disease, diabetes, or other medical conditions. Your provider can assess your current health status, help you set realistic goals, and determine if certain exercises need modifications. Once you have clearance, follow these safety tips. Start slowly. Benefits begin even before reaching 150 minutes per week. Begin with short sessions, 10 to 15 minutes, and gradually increase duration and intensity over several weeks. Warm up and cool down. Gentle movements before and after exercise help prevent injury and allow your heart rate to rise and fall gradually. Listen to your body. Mild soreness is normal when beginning a new activity, but stop and seek medical advice if you feel chest pain, dizziness, or unusual shortness of breath. Consistency over intensity. Consistency is more important than intensity. Aim for regular movement on most days, rather than occasional, strenuous workouts. How much exercise is enough? National guidelines recommend adults achieve 150 to 300 minutes of moderate intensity aerobic activity per week and engage in muscle strengthening activities on 2 or more days. However, any physical activity, even below these targets, confers benefits. Short 10-minute bouts of movement count toward your total, so multiple brief walks throughout the day are just as effective as one longer session. Muscle strengthening activities improve blood pressure and preserve lean muscle mass. The key is to move more and sit less. Before starting from number 1 exercise, please like and subscribe to our channel, Elevate Health, for more videos and suggestions for a healthy and disease-free, happy life. Number 1, brisk walking. Walking is one of the safest and most accessible exercises for older adults. It requires no equipment, is low impact, and can be easily adapted to your fitness level. Research shows that regular brisk walking, often classified as moderate intensity aerobic exercise, can reduce both systolic and diastolic blood pressure by around 11 and 8 millimeters of mercury, respectively. In one study, participants who walked for 30 to 45 minutes on most days experienced meaningful reductions in blood pressure. Walking also improves balance and joint flexibility, making it an excellent first step for people who haven't exercised in a while. To get started, find a comfortable pair of walking shoes and choose a safe, level route, such as a park path or quiet neighborhood streets. Begin with 10 minutes at a pace that allows you to talk comfortably. This is considered moderate intensity. Gradually increase the duration and pick up the pace until you're walking for 30 to 45 minutes most days. If weather or safety is an issue, consider indoor options like a shopping mall or treadmill. Remember, even 3 short 10-minute walks, morning, midday, and evening, add up to 30 minutes. Real-life application. Many older adults enjoy walking with a friend or joining a walking group. Social support not only makes exercise more enjoyable, but also helps you stay accountable. Consider combining walking with daily errands, such as walking to the market or to social gatherings. If you use a fitness tracker, aim for around 7,000 to 10,000 steps per day, but listen to your body and adjust accordingly. For additional challenges, try gentle hills or carry light hand weights once you're comfortable. Number 2. Water aerobics and swimming water-based exercise is ideal for older adults with joint pain or mobility issues. The buoyancy of water reduces stress on joints while providing gentle resistance, which strengthens muscles and improves cardiovascular health. Aquatic exercises, including lap swimming, aqua jogging, and group water aerobics, use large muscle groups rhythmically and count as aerobic exercise. Studies show that aquatic aerobic training can lower blood pressure and improve arterial function in postmenopausal women with stage 2 hypertension. Begin by finding a community pool or aquatic center that offers senior-friendly water aerobics classes. These classes often incorporate movements like marching in place, leg lifts, and arm sweeps while the instructor monitors intensity. If you prefer swimming laps, start slowly, perhaps 5 to 10 minutes, and gradually increase your time. The water's resistance gives your muscles a workout without the wear and tear of land-based exercise. Additionally, water exercise can improve flexibility and balance, reducing the risk of falls. Always enter and exit the pool carefully and consider using a flotation belt for support. Real-life application. Many community recreation centers offer discounted water aerobics classes for seniors. Participating in a class adds a social component that makes exercise fun. Those with joint replacements or arthritis may find water exercise more comfortable than other forms of aerobic activity. If you swim laps, use different strokes, freestyle, breaststroke, to work various muscle groups. As with walking, aim for moderate intensity. Your breathing should be elevated, but you should still be able to speak in short sentences. Number 3, resistance training. Resistance or strength training involves using weights, resistance bands, or your own body weight to build muscle. Beyond improving strength and balance, research shows it also has measurable effects on blood pressure. A 2025 systematic review found that circuit-based resistance training lowered systolic blood pressure by around 6 millimeters of mercury and diastolic by nearly 3 millimeters of mercury in older adults. This makes it a powerful addition to aerobic activity. How to do it: start light. Use resistance bands or light dumbbells. Even 1 to 2 kilogram weights are effective. 2 to 3 sessions per week. Focus on major muscle groups: legs, chest, back, and arms. Repetitions. Aim for 8 to 12 repetitions of each exercise, 2 to 3 sets. Examples: chair squats, seated bicep curls, wall push-ups, and step-ups. Strength training not only helps blood pressure, but also maintains bone density and reduces fall risk, critical factors for healthy aging. Number 4, isometric exercises. Isometric exercises involve holding muscles in a static position without movement. Recent studies highlight them as the most effective type of exercise for lowering blood pressure. Common examples include wall sits and planks. A 2023 analysis showed these exercises can reduce systolic blood pressure by up to 10 millimeters of mercury, outperforming traditional aerobic workouts. How to do it? Wall sit. Lean against a wall with knees bent at 90 degrees and hold for 20 to 60 seconds. Plank. Rest on elbows and toes, keeping your body straight, and hold for 20 to 45 seconds. Repetition. Perform 3 to 4 holds, resting 1 to 2 minutes between. Isometric training is especially helpful for older adults who cannot tolerate high-impact activities, though it should be done cautiously if you have heart conditions. Number 5. Yoga. Yoga blends gentle movement, stretching, breathing, and relaxation. A 2024 meta-analysis found that yoga reduced systolic blood pressure by about 6 millimeters of mercury and diastolic by 4 millimeters of mercury in people with hypertension. Yoga also helps reduce stress and improves flexibility, which indirectly supports heart health. Recommended styles: gentle yoga or chair yoga, best for seniors with limited mobility. Breathing techniques, pranayama, proven to calm the nervous system and reduce stress-related spikes in blood pressure. Relaxation poses, such as legs, up the wall, or savasana, which promote circulation and calmness. Yoga can be practiced at home with online videos or in local community classes tailored for older adults. Number 6. Tai Chi. Tai Chi is a slow-flowing martial art often called meditation in motion. For seniors, it improves balance and prevents falls. A 2025 meta-analysis concluded that Tai Chi reduced systolic blood pressure by nearly 8 millimeters of mercury and diastolic by 5 millimeters of mercury in adults with hypertension. These benefits are comparable to those of light aerobic training. How to practice group classes? Many community centers and senior programs offer Tai Chi sessions. Duration, 30 to 45 minutes, 3 to 4 times a week. Movements, slow, controlled arm and leg motions coordinated with deep breathing. Beyond blood pressure, Tai Chi enhances mood, reduces stress, and strengthens legs for better stability. Number 7. Cycling and dancing. Both cycling and dancing combine cardiovascular fitness with enjoyment, making them excellent choices. Short-term cycling interventions in older adults have shown improvements in blood pressure, vascular health, and fitness. Even stationary cycling at home for 20 to 30 minutes, 3 to 5 times per week provides benefits. According to Healthline, cycling supports joint health, enhances endurance, and is gentle for seniors. Dancing dance therapy, according to a 2024 meta-analysis, lowered both systolic and diastolic blood pressure significantly in adults with hypertension. Dancing also engages memory and coordination, which benefits brain health. From ballroom to line dancing, the social aspect adds motivation and joy. Putting it all together, each of these 7 exercises, walking, swimming, resistance training, isometric holds, yoga, Tai Chi, cycling, and dancing, has unique strengths. What matters most is consistency. Choose activities you enjoy, rotate them throughout the week, and build them into your lifestyle. Remember, you don't have to do all 7. Even picking 2 or 3 that fit your lifestyle can meaningfully lower your blood pressure and improve overall health. Bonus tip: breathing and relaxation for blood pressure control. Sometimes the simplest practices make the biggest difference. Alongside physical exercise, deep breathing and relaxation techniques are proven to lower blood pressure. A 2024 review highlighted that slow, diaphragmatic breathing, about 6 to 8 breaths per minute, can reduce systolic pressure by up to 5 millimeters of mercury in adults with hypertension. How to practice: find a quiet spot. Sit comfortably with your back supported. Place one hand on your belly. Breathe in deeply through your nose, letting your belly rise. Exhale slowly through pursed lips, allowing your belly to fall. Repeat for 5 to 10 minutes daily. You can combine this with meditation, listening to calming music, or practicing mindfulness. Over time, these short sessions calm the nervous system, reduce stress hormones, and support the benefits of your exercise routine. Think of this as your anywhere exercise, whether sitting in a chair, lying in bed, or waiting in a doctor's office. You can use your breath to bring down pressure and boost calmness. Conclusion: high blood pressure doesn't have to control your life. You can take charge with movement, consistency, and small daily changes. The science is clear. Just a few sessions each week can reduce your numbers by 5 to 10 millimeters of mercury or more, which is comparable to the effects of some medications. The key is to start where you are. Pick 1 or 2 activities you enjoy, stay consistent, and gradually build up. Pair these with breathing exercises and relaxation techniques, and you'll not only manage your blood pressure, but also boost your energy, mood, and independence. Remember, your health journey isn't about perfection, it's about progress. Every step, every stretch, every mindful breath adds up. Take the first step today, and your future self will thank you. If you find this video helpful, please don't forget to like and leave a comment. It really encourages us and also signals to YouTube that our content is valuable. We create videos like this to help you live a healthier life. A lot of research went into making this video to ensure you get accurate and beneficial information. While we couldn't include every detail in the video, all the research sources are linked in the description below for those who want to explore further.